In this video, we discuss the use of low-dose interferon during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Interferons were first identified in 1957. Interferon alpha, a subtype of interferon, has been approved for human use in cancer since 1986. Interferons are small, signaling proteins produced and released by host cells in response to the presence of viruses. They are named for their ability to interfere with viral replication. High-dose interferon alpha was a first-line treatment against melanoma for many years, where it achieved response rates of about 20%. Due to high toxicities, high-dose interferon is hardly ever used in cancer treatment anymore. Interferons act against cancer by upregulating the immune response, upregulating p53, a key tumor suppressor protein, and increasing cancer antigen expression, making it easier for cancer cells to be found and destroyed. Interferon alpha has been shown to be effective against hepatitis, with a lower dose being more effective than a higher dose. Even oral longazins with just 500 IU, a tiny fraction of what is normally administered in cancer treatment, has been found effective at reducing hepatitis relapses. At doses that would be considered low dose in cancer treatment, interferon alpha has also been shown to be effective against multiple sclerosis. There is strong evidence that there is a viral component to multiple sclerosis, just as there is to many cancers. Interferon is rapidly cleared by the kidneys. Low-dose interferon was not able to be detected in the blood of animals who had it administered to them orally because of this effective filtration. This led Western scientists to conclude that interferon needed to be injected intravenously at high doses in order to be effective. What this neglects is that this low-dose interferon was actually having an effect on thousands of genes, even if it wasn't detectable in the blood. This is now a major area of anti-cancer research, the STING pathway. STING stands for stimulator of interferon genes. There are also a preponderance of interferon receptors in the nose, mouth, and throat. The beginning of the immune system is the nose, mouth, and throat, where the inside of the body begins to interact with the outside world. This makes intranasal or oral administration for interferon a very promising method. Interferon is present in the entire body in amounts only reaching a nanogram. Western scientists administer interferon on the milligram scale 10,000 times more than is present in the entire human body. When delivered in a dose like this, anything would be toxic. Incredibly, even at this toxically high dose, interferon is still able to show efficacy against cancer. Low-dose oral or intranasally administered interferon alpha has powerful positive effects on the immune system with very few side effects. 200 IU of human interferon alpha administered orally as lozenges was found to increase natural killer cell activity in humans relative to placebo. 2 weeks after stopping interferon treatment, natural killer cell levels in the volunteers returned to normal. These results were confirmed in another placebo-controlled human trial of orally administered alpha interferon in 20 volunteers. In another human study, human interferon alpha was administered orally. Volunteers were told to swish 1 milliliter doses in their mouths for 3 minutes before swallowing. 1,000 IU doses were found to be immunostimulating, while 10 million, doses similar to what would be given for most cancer therapies, were found to be immunosuppressive. In another study, 5 healthy human volunteers were given oral administration of a 125 IU interferon alpha tablet. Each volunteer sucked on it until it dissolved. 2.5 oligodinylate synthetase is an enzyme that reacts to the interferon signal. The blood levels of 2.5 oligodinylate synthetase increased to 4,000 to 8,000 picomoles per deciliter 5 hours after tablet administration. In the second part of the experiment, healthy volunteers had intramuscular injections of millions of IUs of interferon. Again, this is very similar to cancer treatment. The levels of 2.5 oligodinylate synthetase in the blood were found to be higher in the volunteers who had sucked the tablet than those who had an 80,000 times larger dose injected into them. One placebo-controlled trial tested human interferon alpha's effect on appetite, body weight, and mortality rate in 91 underweight patients with advanced malignancies. 3 different doses were administered: 0.05 IU/kg, 0.5 IU/kg, and 5 IU/kg. 64% of the subjects given 5.0 IU/kg reported an increase in appetite or body weight after 5 weeks, in contrast to only 29% of the placebo-treated subjects. Additionally, the patients who received interferon had half as many deaths as the control group. In the only phase I trial of low-dose oral human interferon alpha, interferon was found to be safe and did not cause any serious side effects. The 25 cancer patients who participated in the 8-week trial had various types of cancer and were refractory to at least one line of treatment. There were no complete or partial responses, but there were 5 patients who experienced a slowing of progression, including one case of advanced renal cell cancer who was stable for 20 months. It may have been beneficial to continue the interferon for longer than 8 weeks for these 5 people. In the book, The Case for Interferon, Dr. Joseph Cummins, who performed many pioneering studies with low-dose oral interferon, recounts at least 6 cases of people, including his own mother-in-law, who had regression from cancer that was deemed to be fatal by the medical establishment due to low-dose interferon. Interferon is by no means a cure-all, but it seems like it is as close to being a help-all as possible. It has very few negative side effects and synergizes with most medications. The Soviets never made the same mistake as Westerners in thinking that interferon must be given at thousands of times the normal physiological dose. Low-dose interferon remains very common in Russia for the treatment of several illnesses. It is very rare to find any medical doctor in America who will prescribe low-dose interferon, as most medical doctors are only familiar with high-dose interferon. One medical doctor, Dr. Stephen Cantrell, working out of the Neoplus Clinic in Tennessee, administers low-dose interferon concurrent with a statin. Dr. Cantrell was a surgeon at Memorial Sloan Kettering, one of the most prestigious hospitals in the country, when he developed melanoma. After numerous surgeries, Dr. Cantrell used low-dose interferon along with a statin and cured himself. He now considers it his personal responsibility to share this treatment with others and claims to have clinical benefit rates reaching into the 70 and 80% range in advanced cancers. His website is neoplus.org. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.